Hey guys, so we're going to do a quick little cross-sectional cut of this pancreas and how we're used to seeing it versus these sagittal cuts, which I know are throwing some of you guys for a loop. So I've set up a little Play-Doh module. So what we're used to seeing is an image like this in the transverse plane. Ignore this part because normally we don't see this since it's superior to the pancreas. But when we're looking at the pancreas, this is kind of what we're used to seeing. The head portion over here, the neck that's anterior to the SMV, the unsnate little process hook at the very posterior portion. And then we have the body, which just lies over aorta. So remember, my body lies over aorta. My head lies over the IVC. So my body lies over aorta. My head lies over the C. Then we have the pancreatic tail here, and the only thing posterior to that pancreatic tail and body that we're used to seeing is that splenic vein. And again, we're in a transverse cut, which is why we're able to see that splenic vein in a long cut typically. Now, I know the big confusion is when we start doing cross-sectional sagittal cuts of the pancreas, so hopefully this will help. I'm not going to do the cutting of the IVC and the aorta. They will be in long for the purposes of this video. So again, we're going to start with the head. Now, when we think of the head, in our ultrasound pictures, what we're used to seeing is a little piece of pancreatic tissue and two black anechoic structures right near the head. So again, my body lies over aorta, my head lies over IVC. So if we go through and we do a little chop, and again, for all purposes, we're just going to go through and assume that the IVC is going to be posterior in this. So I'm going to move this out of the way. So here's our little cross-sectional cut. Now we are going superiorly, so if we get our little fake ultrasound image, we have our notch up here. So again, for scanning, we want that notch towards the patient's head. So when we cut, we're going to cut just like this. And when we go through, what we're going to essentially have is going to be a cross cut that looks like this on the screen. Now, again, we're going to get nice and close. So we have this, and I made them much larger for viewing purposes, but we have the hepatic artery, and then the portal vein, the main portal vein, and then the pancreatic head. Now, why are we seeing this? Why are we seeing the hepatic artery? Well, we know, and I'm going to put this back for the purpose of the video. So we know that normally in our transverse pancreatic image, we see posterior to the body, we not only see the splenic vein, but we also see our SMA, which we have right here coming up. And we're used to seeing that in a cross-sectional cut. So we're used to seeing the stomach, and then just posterior to that, we see the pancreatic body, and then posterior to that, we have the splenic vein. And then again, in our cross cut, we'll see the SMA just anterior to the aorta. So if we're going through and we think we'd have to actually physically move up sagittally or in the transverse image to see our celiac axis, if we can see the SMA, then we would need to physically move up or turn in a sagittal plane in order to accompany that SMA with the celiac axis. So with that, that means our celiac axis goes anterior, which we know at this point, and then it has three branches, two of which are visualized, one being the hepatic artery, and the other, again, this is our seagull, and then our splenic artery. So if we look at the posterior side of this, bear with me. Or if we look at this is our little seagull. So if we're looking at the end that I'm looking through, this is our little seagull. So we're going to put you right back here and prop this up just a little bit. So again, we take that sagittal cut of our pancreas head, and what we're going to end up seeing is what's superior to the pancreas head, which is going to be, again, we'd have to move our probe up to see it if we were in a transverse plane, but in sagittal, we are able to see the hepatic artery and the main portal vein. Now, I know there's some confusion with what are we going to see when. Well, above the pancreas neck and the pancreas head, we will typically see, again, this nice little cross cut of the hepatic artery. However, once we start getting over to the aorta, where the actual celiac axis is, that's when we'll start seeing the splenic artery in a sagittal crosscut. So again, when we're going through and we think of our nice long image. I'm gonna pull this out. Come here. So we'll have our IVC sitting at the bottom of our screen, just like this, because again, we're going from anterior to posterior, and now this portion is no longer right to left, it's now superior to inferior. So we'll see this, and then just above it, we'll see a little cross cut like this. So with that, if we turn, there is our long cuts of our pancreas, our nice long IVC, and then just a little cross cut of the hepatic artery and the portal vein. Now, the portal vein might not necessarily be that nice, perfect round cut that you're looking for. That's okay. When it merges to form that portal splenic confluence, it kind of takes an oblique angle of incident up. So that's why we're not getting that nice little circular cross cut that we're seeing in the hepatic artery, because the hepatic artery travels completely horizontal. So when we cut it, we're literally just doing a straight cut, making it circular. Whereas the portals, we kind of come in at a little bit of an angle, getting almost that little slight oblique cross-sectional cut that you can kind of see here. So, and then once we're done with this, I'll do a little pre-trial of what I have drawn on the board. So that is the head of the pancreas. And again, my head of the pancreas lies over IVC. Now, when we go to the neck, that's when we get our cheeseburger sign. We're pretty, I know we've seen this on a couple different tests, but I wanted to really elaborate on why you see what you see. And I'm putting things away as we go. So again, we're gonna go through and do our sagittal cut. Now, we might not get the IVC posterior to the neck, or we might only get a portion of it, or we might get a little less posterior to the head. It just depends on where that person's IVC lies in the body, but typically the head/neck area of the pancreas will lie anterior to the IVC, where the body will lie anterior to the aorta, and the tail will lie anterior to nothing, which we can really, I mean, a couple little arteries and veins, but no major abdominal organs like we typically see. So again, if we go through and we do our nice little cross cut, and I'm gonna go and just hack this right down the middle. Again, we're seeing the neck. We're seeing the uncinate process. So we're gonna poof this back up just a little and clear it out. So if we are looking at our screen, this is what we see. We have our little quote unquote cheeseburger sign. So I'm gonna hold this up. I have very small hands, so bear with me. Actually, let's take this and prop this up right here. My Play-Doh lids are becoming quite helpful. So this is what we typically see on the screen. I'm gonna get a little closer so you guys can see. There we go. So this nice, pretty, long green portal vein is actually going to be our SMV. I'm going to call them portal veins unless we're being specific, just because they're all in the portal system. So we're in sagittal, so we're in a long cut. So we know that we're going from superior to inferior. So we're going from essentially what is the portal splenic confluence, because that's where they both merge up here on this end. And then this whole nice long vessel is going to be our SMV, and it's going to go course from inferior to superior until it meets with the splenic vein, where it becomes the portal splenic confluence, essentially right in this general area. I'm gonna move this out of the way. And again, it's easier for me to hold this with two hands. So again, you may or may not see the hepatic artery in this cut. You typically will see a little cross cut of it. And then we have this big portion right here. And again, that's going to be anterior to the SMB. So we know that this is the pancreatic neck. And then the bottom bun of our cheeseburger sign is going to be that small hook-like projection posterior of the neck. And it's going to be the uncinate process. So again, this is our cheeseburger hamburger sign. And this is what you're typically going to see. And again, that's because we cut it right at the neck. You may or may not get cross cuts of the IVC, and again, it just depends on where we're at. But what you really want to do for this picture is elongate the SMV and get a nice clear uncinate process and neck separation. So we'll put this back down, and we're pretty much done with the IVC, so I'm going to take that out of the way. And again, the head and the neck are going to lie anterior to the IVC. Again, typically it's the head, but you may get portions of it in the neck, and then our body lies over aorta. Now, again, with this, we have to remember that the pancreas lies inferior from our celiac axis. So our celiac axis point is actually starting above. So for this purpose, it's very hard for me to show you guys, but if we go through, this is essentially what our aorta looks like, and we can see our celiac axis, and then this is our pancreas. Now, again, where we're at is pretty much the split. It's our Siegel, and we already determined that this side is the right side due to it. I'm using this as if I'm the patient. So again, this is going to extend up towards the hilum of the liver. So this is the hepatic artery, and then the other branch that travels to the left-hand side of the body is going to be our splenic artery. So, but again, we can't hit that splenic artery until we get anterior and cross over the aorta, because this is where the hepatic artery and the splenic artery originate. So again, I'm gonna lay this back down. I'm gonna take off this little portion of the SMV because we no longer need that. So again, we're sitting right on top of this aorta. We have our celiac axis back here that you can't really see. And then we have, again, our little portion of our hepatic artery that's still going over the neck, and then we have the splenic artery that courses laterally towards the left. So if we go through, and again, I'm going to take my little cross-sectional cut, and I'm going to just chop it right down the middle. And with that, when we get that aorta nice and elongated, we're going to see what we're used to seeing in a sagittal aorta picture, which is going to be, okay, with everything taken out, sagittal aorta, in the middle we should see the SMA, and then superior to that on this side, which you can't see, is the celiac axis. So we cut it right down the middle, going through, and you will see what essentially is going to be the aorta in the background. So again, we're used to seeing that aorta, so I'm going to take this and move it just because we're used to seeing that sagittal aorta cut. So when we cut it, I'm going to take the splenic artery off. This is what we're used to seeing with the aorta. Pull my SMA out. So this is what we're used to seeing with the aorta. With that, it looks kind of like this on the screen. So again, I'm exaggerating it quite severely, but this would be our celiac axis, and then this is our SMA, and then we would get a nice tubular structure here for the aorta. So with that, in the sagittal cut, I go through, bear with me. So I'm going to do a 180, 360 turn. And then this will be just like this. So this is what you'll see on the screen for the most part. Again, you're going to have the a little portion coming off of the celiac axis. It's a very small extension branch before it trifurcates actually to the hepatic artery and then the splenic artery, which for all purposes we'll assume that the splenic artery is coming towards me. So the portion you can see is the patient's right. So again, if we're doing that sagittal cut, we cut it. And again, this is typically what you're going to see. You're going to see a nice elongated aorta on the back portion, the posterior portion of your screen, with an SMA sticking up just like this, and a little celiac axis. And then again, in between those two, you should see, or I shouldn't say in between those two, anterior to the SMA, you should see what looks eventually like this. So you'll see an elongated aorta, and then just the body, and then posterior to the pancreas body. And again, think about the pancreas and transverse. What lies posterior immediately to that pancreas body? It's going to be, give you a second to think about it. Think about your long axis of the pancreas, which is a transverse scanning plane. What is directly posterior to the body and the tail? If you said splenic vein, you are correct, because again, we know that the splenic vein is going to go through and course just like this. So a nice sagittal crosscut will look like this. It'll be a circular motion, or a circular portion just posterior to the body of the pancreas. And again, the shapes might be a little different depending if someone has a thicker AP or a superior to inferior, bigger pancreas, so it just depends. But again, typically what you'll see is anterior pancreas, and then just posterior you'll see a crosscut of the splenic vein. So I'll lay this back down. And now we can get rid of our aorta, because once we get out of the body, we no longer see, once we move into the tail, we no longer see the IVC, we no longer see the aorta, because the aorta lies directly posterior to the body. So we'll see the tail. So this is all we have left, is this tail. Now we chop this tail, and depending on how this courses may be where you see it, because at some point this green splenic vein is going to have to course up towards the spleen's hilum. So it just depends on where it may be at that you may see that little cross cut. But again, typically you're going to see it posterior just like this, or you might see it up a little bit superior, or you might see it like on the lateral, inferior. It just depends on how that tail is coursing, but what you're basically going to do is follow that splenic vein over until it ends. And then all you'll see is just the pancreas tail and the splenic vein. Those are the only two things you will see in the picture as far as landmarks go. Now, when we scan, we essentially are going to take our probe and scan along the midline, and we know that the pancreas tail lies to the patient's left. Bear with me, I'm backwards. So it's going to be on the left-hand side. So when we angle, we actually angle essentially from anterior right to posterior left. So this is where a lot of you had the question where you may see in the posterior background, you may see a portion of that kidney. Which kidney would it be? So again, we're angling from anterior right to posterior left. So which kidney would you likely see in the posterior aspect? And it'll essentially look like a little posterior portion just like this. If you said left kidney, you are correct, because again, we're angling from the front anterior right and angling towards our left. So you're going to get little clips, or possibly get little clips in the posterior aspect of the left kidney. So again, when we're going through, you do the cuts. The superior border of the pancreas is going to be made up by the hepatic artery, which will course towards the superior right, and the splenic artery, which will course towards the superior left. They are on the very top border, and I know a lot of times we think of our pancreas and we think of it top to bottom, but it's actually anterior posterior. So the tail and the unsnate process lie posterior in the body, and then that hepatic artery will travel along the superior border where it meets with the celiac axis. And then once we hit our celiac axis, the splenic artery will course towards the left-hand side up until it hits the spleen. So I hope this helps. And then again, I'm going to do a little rundown of some pictures as well.